Ladies and gentlemen, it is a lot of pleasure I want to bring to your attention that we've been joined by the President and he's been following this event. He's our guest of honor and he will be delivering his speech virtually.
This is a 100-bed facility equipped with the main health sector, which is one line which controls the facility, and then we have the patient's area.
The facility will not only serve for COVID-19. We have a meningitis outbreak in Upper West in Ghana. It will support us in the treatment of Ebola, H1N1, SARS, and many other infectious diseases. It will be a permanent legacy. We're building a permanent structure which will increase the capacity of the country to treat infectious diseases. This is the first of 4 such facilities which we plan to build. So at the end of the project, we'll increase the country's capacity with 400 plus beds to support and treat infectious diseases in Accra, Kumasi, Takoradi, and Tamale. Round of applause. In addition, you're guaranteed that the fund is very professionally managed. It's been structured so we have 2 custodian banks, Fidelity Bank and EcoBank. We have Stanley as the fund administrator. We have Ernst & Young as the fund auditor. All donations will be acknowledged and published, and all expenses will also be acknowledged and will be published. As has already been said, the fund is a zero-cost fund. All the professionals in the built environment, the trustees, a number of technical partners, Global Media Alliance, Dream Mobile, and many others are all contributing their time pro bono, for free.
So, Mr. Edward Defa, Tony Oting Jesse, the rest of the trustees of the Private Sector Fund, good afternoon, and to let you know how very happy I am to be part of this historic event. I'm sorry I couldn't be with you there in person, but as things are now, this has become the way all of us are conducting our business across the world, so it's just as well. But this fund that has been created by private sector operators to assist in the fight against the COVID-19 pandemic is an excellent idea. It's an excellent initiative, and it is a tremendous demonstration of your commitment to the welfare of our nation. It's a patriotic venture of the highest quality, and I want to thank all of you very much for this initiative. You came to visit with me to introduce yourselves and the idea, I believe a week ago. I think it was the 9th of April that you came. And I remember very much the people who came to my office, Edward Defa, Tony Oting Jesse, Senyo Hosi, Kwame Banfo, famous Sikkens, Julie Isiam, the Daniel Saki, who comes from EcoBank, Kwaku Bediakon, Anthony Sapong, and Julian Opuni. Of course, Senyo Hosi himself. And I remember expressing to you my delight at what you're doing. I believe that when we have a national crisis of the sort that we have today, it's incumbent on all well-meaning citizens of this country to stand up and see what they can do to help the public authorities overcome the national crisis. It's always been my belief that the public authorities of our country cannot by themselves deal with all the problems of our country. There's a lot that the citizenry and private institutions can do, and you are giving a first-class example of that. Raising the substantial amount of money in such a short period of time, designing this project, drawing upon the best of our professionals, whether it's architects or surveyors or engineers, designing the project and bringing on board those who are actually going to do the building and the construction of this. It's the first of its kind, as you quite rightly put out. And I'm encouraged and excited by the idea that you are going to spread across the nation this development so that the major cities of our country, Kumasi, Tamale, Takoradi, and Accra, will each have their own facility, which will be there as a permanent contribution of yours towards the improvement of our public health system in the country. There's very little that I can say other than to stand on behalf of the people of this country, of its government, to say a big aiko, to say a big congratulations to you. It's an excellent example of public-private partnership. And I'm very happy that GNPC, the Ministry of Health, the Ghana Armed Forces, the Ghana Health Service, these important public institutions are an integral part of this development. This is the way that we can best maximize the considerable talents and resources of our country. And we can build a country which calls upon all its talents, wherever they may be, to come together to promote the growth of Ghana. The contribution you are making to the empowerment of our health system is something that is going to be recorded in the annals of our country for many, 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 many years to come. So I want to congratulate you once again. Well done. We're expecting more from you, as you yourselves have promised. When you came to my office, I told you that the public trust fund was also going to be established. It has been so. It's up and running. I think it makes a great deal of sense if you could also liaise and be in touch with them so that together you can pool your ideas as to how best the considerable amounts of money that you are raising, that they are also now raising. So we can all see from the media, substantial sums of money are going to the coffers of the Public Trust Fund to see how best these monies can be most effectively deployed for the welfare of our people. But so that I don't spend too much of your time, I want once again to thank you very much for making me part of this event, to once again congratulate you, and to encourage you, to encourage you to make this kind of initiative a permanent feature of the public life of our country. You know my views about the role of the private sector in the development of our country. And I think that this initiative is vindicating the views that I have and of how Ghana should go forward. Well done, and may God bless you all. And may God bless our homeland Ghana and make her great and strong. Thank you.
Your Excellency, you just marked history, and I will stand to be corrected. This must be the first time we are having a keynote or the guest of honor making the submission digitally. We have moved one step ahead and we are proud to be part of your history. You inspire us every day, and as you rightly said, you did inspire us again. And we are out to live by what you have asked us to do, to be citizens and not spectators. We have come this far not by just private sector effort, but because you have put to our use your resources, your network within the public sector, the Ghana Armed Forces, the Ministry of Health, the Ghana Health Service, and surely the Ghana Medical Association, who have also been with us. We are most grateful. If you could still hear us, we'll need you to kindly nominate who would have to do the groundbreaking for us.
I believe there's no, the minister is not there. So why don't we then go to...
It's not here, sir.
The minister is not there, and there's no public official there, is there?
We have the Ghana Health Service
Who...
Director? No, I don't think he's arrived. No.
But what about the co-chairs?
But we surely have Lieutenant...
The co-chairs of the fund, of the trust fund, Edward Ifa and Dr. Tony Otinjesi. Why don't they together grab the spade?
Very well, sir.
In both hands, jointly, and do it on my behalf.
Very well. Let's give the president a round of applause. Our president is on time, you know what I'm saying? He's a modern man. So, Mr. Ifa, Mr. Otinjesi, and Lieutenant Colonel Techi, all the trustees present, the technical committee chairman, Dr. Justice Youngson, our custodians present, the landlord of the place, Dr. Odro Mensah, would support you, break ground.